Welcome to Evening Tea, a slow after bedtime space for women who are exploring motherhood differently. Here we talk about the things you whisper about with your closest friends, the tender, the intuitive, and sometimes controversial. From pregnancy, home birth, postpartum healing, vaccines, natural health, motherhood, parenting, identity, and everything in between, nothing is off the table here. So pour yourself a cup of tea. Take a deep breath and settle in. I'm Chaya, and this is the conversation that you've been craving. Today's conversation comes from a very curious place for me. I am always learning about new ways of healing, not because I'm looking for something to fix, but because I'm a mother and I care deeply about my body and my children's bodies, and I love to know what options exist for when things feel off. I've used acupuncture before. I've used it for trying to induce labor. It didn't work in my experience, but that is kind of where my experience with acupuncture stopped. So I've always wondered what else it can help with. What does it actually do? What does it look like when it's used to support women more holistically, especially through pregnancy and postpartum periods, even after birth? In my postpartum period, after having my first baby, I felt a lot of pressure to bounce back. And I put that in quotation because I hate the phrase bounce back, to get back to myself very quickly. And it made things a lot worse for me, kind of like I was rushing instead of slowing down and letting things take its time. That taught me that slowing down isn't optional. It's not a luxury, and it is something so necessary when it comes to motherhood and birth and healing. And that kind of brings us into this conversation because it's not about doing more. It's not about adding another thing to your list. It's about learning about what exists and remembering that there are so many women out there who offer care and support and healing in ways that don't feel rushed or overwhelming. I'm really, really grateful to be joined by Miriam Pineles. Miriam is a Chinese medicine practitioner, and her work sits at the intersection of the body and the mind and long-term healing. From what I've heard and from what we've spoken, she is someone who has lived deeply inside this work, and I'm very excited to listen to what she has to say. Miriam, I'm so glad you're here. Thank you for being here with us.
Thank you so much for having me. It's really a pleasure. And I'm excited to have this conversation.
So, for the people who may not know you yet, how do you usually describe the work that you do?
Well, as you said, I'm a Chinese medicine practitioner. And what that means is Chinese medicine is a umbrella term for different techniques and modalities used to help both the mind and the body heal. So the umbrella term for the way I'm able to support weak people is one with acupuncture, which is the use of fine needles in various areas of the body to create an effect for healing. The second item is herbal medicine. So Chinese herbal medicine is comprised of hundreds and hundreds of different herbal medicinals that we use to support a person in their healing. Diet, lifestyle coaching, nutrition, also a part of Chinese medicine where we're checking always in with the whole person. So not just fixing symptoms and disease, but working from a preventative place as well, making sure a person is eating the right foods to their constitution or whatever it is that they're dealing with. And then also meditation and movement exercises are a part of Chinese medicine as well. So my work as a practitioner is one, to help heal and alleviate pain, and two, to strengthen the body and person to prevent future illness and disease.
Wow.
So, yeah, um, the medicine is known as a root branch medicine of, like, if you think of a tree, right? We're ending the month of Shvat right now, all about the trees. So symptoms like a migraine or menstrual pain or postpartum fatigue, these are the branches sometimes of a person, like the symptoms showing up the outer layer. And Chinese medicine will help alleviate those pains and symptoms, but we're also going to go into the root and and find out why those symptoms began in the first place. Okay, that's the beauty of the medicine and why it's so effective is that we're getting to the root cause and we're like digging it up
Wow.
and supporting it. Yeah. And that's why when it's done right, it will work. So I definitely want to get back to what you shared in the beginning about it not working for you. And I would love
Yeah,
to explore maybe
we'll
why it,
definitely touch on that.
yeah, later on.
Yeah, exactly. I know for myself, and I I don't like speaking for other people, but I've heard very often that when people hear Chinese medicine, even like acupuncture or herbal medicine or, the different modalities that you were describing, they tend to have a very narrow picture of
Mm,
what that looks like in a practical way. So
mhm.
my question is, when someone comes to you for a session, what does the practicality of it look like?
Okay. Um, so practically a person will come in for an initial visit. That first visit is usually 2 hours in length at minimum, where a full medical health social history is taken. And once I hear the history and a person's goals for treatment for coming in, I'll then do an assessment. And a Chinese medicine assessment is a way to again to understand the root cause of what's going on. And because thousands of years ago we didn't have x-rays, blood tests, and the modern means of diagnoses, we use our ancient techniques. So that will be pulse reading. It's a very sophisticated system of pulse reading where by feeling different areas of the pulse, we can determine which organ is sick and the nature of the disease and then be able to best treat it.
Oh,
Yeah, most
that's
people are really
incredible.
yeah, it really is incredible. It's really magical. Like that's kind of one of the reasons I jumped into being in this medicine because when I had my first acupuncture visit, I was very I mean, the practitioner had me at hello, like just the whole experience of being listened to in such a deep, real way. But then when the practitioner felt my pulse, I was just so blown away that my physical body was able to tell the practitioner what to do.
Yeah.
Yeah. So we'll feel the nature of the disease. Is this person sick because their body is too tired? Are they sick because they're under too much stress? Are they sick because there's too much inflammation? All of these things we could feel with our fingertips and then choose the appropriate treatment. So the pulse is a major way that we diagnose, but we'll also look at the tongue and the ear. We'll look at the coloring of a person's face. We're going to feel temperature of their hands and feet, abdomen, and we put all of these pieces of information together. What's cold, what's hot, what's dark, what's tight to create our treatment plan. And then in that first visit, a person will have a treatment, which is usually acupuncture. And depending on the case, they'll also go home with an herbal prescription that they'll take for 2 weeks to 3 months sometimes. Most people come in once a week for a minimum of 6 weeks. Some space it out a little bit more, but typical treatment for anything is going to be between 6 and 12 weeks. And we can monitor their progress by checking back in with that pulse at each visit, hearing about the symptoms in the patient, what's going away, what still needs work.
So this is very powerful work. This is very powerful healing. Wow.
Yeah, it is.
I never knew how deep it went. That's so
Oh gosh,
interesting. Wow.
it's very deep.
Yeah.
And let me say one more thing, because this is what everyone has issues with. Like some people are very scared of needles, right? So if someone listening to this is like, oh, I can't do needles. So if a person really can't do needles, there are other ways that we could treat them. So in Chinese medicine, we can do acupressure on the acupuncture points. We could do very light massage work. And we have other touch modalities like cupping and gua sha that I use on kids. I don't necessarily use needles on kids. So there are other ways to be treated so that if needles are seriously an issue, um, there's ways to work around it.
That's really good to know for anyone listening that has a fear of needles. I would love to come back to kind of what I had said in the beginning of the intro in terms of my experience with acupuncture. Um, I what I learned afterwards was that I was rushing. Like, I was so over being pregnant. I was in so much pain and I was so uncomfortable. And I was like, I need this baby to come out. I had such a great pregnancy. It's been so much fun. I'm done. So, someone referred me to go to an acupuncturist. I went and it kickstarted some contractions and then they stopped and went away. And he actually was very kind and told me to come back 2 days later if I didn't have the baby yet. And he did it again and it started some contractions a little bit for like an hour or so. And then it stopped and went away. And at some point, I had to kind of shift my mindset to stop being in a rush, let your body do its thing, let your baby be ready when it's ready.
Mhm.
Um, and kind of like surrender to my baby's timeline. So, what I want to ask you is when it comes to pregnancy and labor and postpartum, in what ways are you able to support women? Or, for example, me being in that situation where I was like, I just need this baby to come out. How are you able to support that person in learning either how to trust their body and trust their baby, that it'll take their own timeline, or to encourage labor to start or to help them alleviate whatever pain they're going through in that moment?
Big question.
Yes,
This is a great
it's
question.
a personal one.
Yeah, for me too, my own birth experience, but also like this is a huge passion for me because it's not understood well enough. Um, can I just ask two questions? It was your first baby
It was my
at that
first
point?
baby,
And at how many weeks did you start the acupuncture?
40, on my
Yeah.
due date.
Yeah, yeah. Okay. Here's the thing. Okay. There are times where, okay, a woman is done and the body is primed and ready so that she can go at 40 weeks for acupuncture. And there are times that will be enough. She'll get into labor, have her baby. Okay. But that's really not what I see. Okay. And people who know me and doulas that I work with, they know I tell women, please come in at 34 weeks to start your acupuncture and your birth preparation. 36 the latest. Yeah, yeah. Yeah, yeah, yeah. I'll tell you why. Because birth is not just a physical experience. It is not just about the physical mechanics of birthing a baby. For a woman, most women that I know and work with, there's a lot more involved. Judaism teaches, and the medical world used to also, that the mind and the body are interconnected. So for a woman's physical body to be able to birth a child, we have to keep in mind her physical body is intertwined in her emotions, her life experience, her soul, like her experience of life. And so when there are challenges and symptoms showing up in pregnancy and even towards the end, whether it's like I'm done, or anxious, fears, that's going to have an effect on the physical body. Our mindset and our emotional state is going to have an impact. And if there are stuck emotions in a woman or fears based on her last birth or stress at home, whatever it is, um, it's going to cause constriction. And that constriction is going to make it very hard for this flow of birth experience to happen. And so it's very important for me and thank you for providing this platform, that women know to start early, because at 40 weeks, we don't have a lot of time to help you process what's going on in you, right? Why hasn't the body, again, it was your first, so this is normal, but for the body not to go into labor, right? Or for those contractions not to be able to sustain. There's reasons. It's not all emotional, it's also physical. Like if a woman had a very difficult pregnancy, and then her body is weakened a bit, perhaps from HG or she went into it maybe with an autoimmune condition. Her body's already in a depleted state. She's going to need strengthening to get into labor and have those contractions keep going. The body needs energy for that to happen. So a few weeks of acupuncture can strengthen her enough so her body can have the strength to get through labor and thereby hopefully avoid too much medical intervention, right? Um,
That makes so much sense.
Yeah, yeah. So that could have been why, when I hear contractions started and stopped, sometimes it's just because the body's too tired to
Yeah,
keep it
it
going.
makes sense.
Yeah, and the woman's burned out, so she needs to be strengthened. Sometimes she's, high stress, type A personality, worked the whole pregnancy, and there's a lot of stress and tightness in the body. And we need some time to like unwind all that stress. It just needs some time. So 40 weeks doesn't give us time. But if she comes in at 34, 35 weeks, we have time to get her ready. Um, and what I see a lot lately is women who have had several births and maybe they didn't go the way they wanted or they were painful and they're looking for this next one to be better and they know so they'll come in really early and we have time to work through blockages, fears, things that women don't even realize are holding them back from their birth that I think like the baby and wants them to process before coming into the world. So we could talk more about that if you want.
Yeah, absolutely.
Yeah.
After having my second baby, I learned so much about how involved the baby is in pregnancy and in labor.
Mm,
And it's so it's fascinating to me how the baby literally can do all the work. You can just exist and the baby will do everything
interesting.
as long as it has the tools for the body. Like you were saying, the body needs to be strong enough and
Yeah.
needs to work through all of those emotions or anything that's trapped. So if those tools are available in terms of labor, like the baby technically can do most of the work on their own. So I'm just curious, like when it comes to women in that last trimester that come to you from 34-week mark, those last 6 weeks of pregnancy, what are the most common things that you see that women would need help with?
So they come in with anxiety, stress, heartburn, pubic pain, leg pain, swelling, elevated blood pressure, elevated liver enzymes, things that, especially depending on their age, could be very concerning. And these are the women who, especially with the more serious symptoms, they are almost threatened with inductions, medical inductions. And so they quickly seek out acupuncture to do what they can to avoid that. And so, like I said in the beginning, I work with the symptoms and the branches, the physical body, and acupuncture is very effective in calming and relieving anxiety and lowering blood pressure. We can do these things, but because there's an intersection of body and mind, I take very seriously a woman's state of mind and emotional history, and if there is a trauma history, because those are most definitely impacting her body at this critical time pre-birth. And so I do a lot of talking with my patients during the treatment, helping the body to clear old pain and memory. Um, yeah. And for the really sensitive women, I don't even have to say anything, just the act working on their bodies with intention, it comes to them. And they're like, they bring up a fear they didn't realize they were holding, or they bring up a trauma that occurred 20 years ago that never got spoken. And
Wow.
when that, yeah, yeah. And all of these things, when they come up and they're spoken and then cleared, there's impact on the body. The baby starts to descend. The woman's more calm and regulated. And like I've seen with my own eyes, like women go from exhaustion and panic at 34 weeks to calm and empowerment at by the time it's 40 weeks. And that's something I'm just so happy to be able to help.
Yeah, that's incredible. For
Mhm.
whoever's listening, you guys heard it here. Start acupuncture at 34 weeks. Clear all the
Please.
trapped emotions.
Yeah.
Clear everything.
Yes.
Wow.
And that's good and helpful. But I also want to say to the women listening, if you have had chronic illness, chronic emotional pain in your life, start even earlier. Start at 16 weeks and go once a month, whatever you can afford and do, because women need support. You just need so much support. Like, I start seeing women very early because they'll come in for morning sickness, right? And sometimes that morning sickness stays on a physical level and we just clear the discomfort as much as possible. It's often also, though, interconnected with an emotion, a painful history. So some people will need more support than others.
This work feels so relevant for, like we were saying, pregnancy, birth. I'm curious about postpartum. When a postpartum woman comes to you, what are you listening for beyond the symptoms?
I'm listening for what the birth experience was. I'm listening for what is transpiring at home currently and what transpired when this woman was a child. Because um, when a woman becomes a mother, it can be it's just a tremendous transition. And it can, for someone with a challenging childhood history, some of that pain will come up unbeknownst to the woman where her pain's coming from. But that can be a time where a person has to begin that inner work of their past to heal. So and not every person. Sometimes it's just like super fit. Woman's very fatigued, had a very long labor, pushed to like for hours, and she's super depleted. And because she's super depleted, there might be some anxiety and maybe slow milk flow. So, we'll help the body, we'll help her restore, but sometimes it's a little deeper than that. And of course, I'll refer out to a mental health professional. And your listeners might like to know that the Chinese herbs can help anxiety and depression, whether or not a person is on a medication, and they're very effective in
Wow, that's
calming
very good to
anxiety.
know. Yeah. You mentioned that it can help with slow milk flow. Is that a struggle that you see often that women come to you with breastfeeding issues?
Not so much in my practice, but it is something that we learn in Chinese medicine. There's two reasons why that would happen. One is stress, constricting flow, and the second is weakness, just nutritional, physical weakness, not allowing for enough. So it's things that we can support, we can help sometimes increase the amount of ounces with herbs and help that flow with acupuncture. The Western herbs are also helpful in that regard. Yeah.
Wow, that's amazing. If you're able to and willing, are there any real life encounters that you've had with pregnancy or postpartum and how you were able to help?
Yeah. So I'll start off with a short one, which is when I see women postpartum and people always ask how soon can I come in, right? You can really cut anytime whenever you're ready to get out of the house or have someone over is when it's time. And we do something called mother warming, which involves an herb called moxa, like mugwort. It's a technique called moxibustion. And we wave this herb mugwort over a woman's lower abdomen, and it's postpartum, and it's incredibly healing for her. After going through the hours of birth and being just exposed and feeling so tired, this modality we do helps a woman come back to herself, get grounded. It supports the uterus and the healing of the uterus. So if there's excess bleeding or cramping, this would be helpful. So this is just a great thing to know. Maybe 6, 8 weeks postpartum, a person go see their local acupuncturist, ask them for some moxa on the lower abdomen. It's just a really nice restorative treatment. I think doulas should really know about it because they visit women postpartum, so they could easily do it. You don't need an acupuncture license to do this technique. So that's something really nice. I remember years ago treating a woman in pregnancy to get her through the end. And I felt her pulse, and I could tell from her pulse that she was going to struggle postpartum with anxiety because there's a quality in the heart pulse that I felt, and I felt it was very weak. And so I knew going through birth would weaken it more because that's what birth does. And I knew she would struggle, and she did. And it's just good to know ahead of time. Like I have given women herbs for anxiety before they go into labor to get ahead of the postpartum anxiety that happens. So that's very yeah, I think that's very significant for person to if you don't know yourself well enough, like, the practitioner should be able to tell if there's gonna be a struggle after.
Right. Wow, that's
And we know
incredible.
yeah, we know how important that is, right, for attachment and yeah, for healing. And then several stories, thank God, of women coming in at the end of pregnancy with these liver symptoms. And I wonder if it's because we're at a time, like a stage in time where people are more capable addressing deeper issues. But I had a woman come in. This was her maybe fifth child, and she had plans for a home birth. You know, at like 35 weeks, she started having signs of blood pressure rising, elevated liver enzymes, panic, dizziness. She also had a condition of cholestasis in the gallbladder, which is like a very uncomfortable condition to have. It involves a lot of itching in the body. So women have trouble sleeping and being inside their skin, like very, very uncomfortable. And there's not much that Western medicine can do to help them. And they kind of just have to bear it unless they go see a Chinese medicine practitioner. And so thankfully, it was early enough that I had time to work with her. I think there were times I saw her twice a week because it was pretty severe. And we did a combination of treatments, working the body and the mind. Within a week or two, her anxiety levels were down 50%. Her itchiness was down 50%. Her liver enzymes were going down. Like her body was coming back into more harmony. And the baby started descending. She could feel it happening on the table. It's very cute. Like you said that when you said the
Wow.
baby, yeah, yeah, yeah. When you said the baby knows what to do, right, in birth, I love this part because I had spent weeks with her treating her and we were undoing layers. So things that happened in her prior births that had to be processed and help shift her mindset that it doesn't have to happen that way again. And things from the past, like there was a lot we were working on. And then towards the end, the last treatment, we undid another block, emotional block. So I don't know if people listening understand these things, but there was like something came up for her in her heart regarding one of her children that she needed to heal. And after we discussed it, she was laying on the table and she's like, I've never felt this before, but it feels like the baby just like wiggled and snuggled down into a better position. Like it was the cutest thing. Like often women will feel their babies kicking, maybe with acupuncture, but this was very different. She's like it was like as if the baby was like wiggling its way down,
So interesting.
like it was ready to go because like she
Right.
had cleared this, like the heart wasn't holding everything, and so now everything could descend. Baby can go down.
Wow. Oh
Yeah.
my gosh.
So
This is such powerful work. Wow, that's amazing. I'm curious if there's like an aspect of it for you, like to kind of separate your work from internalizing within yourself. Is that something that you have to deal with?
I get that question a lot. Like people say, how do you protect yourself? Or I don't find it. I've learned through experience and self-work and honestly my spiritual work that it's not mine to carry. And as long as I keep that consciousness that I'm there to support, not to take on, um, and I trust the process, I trust their journey, and I do my best to stay strong and well to keep that going. Could it be that I'm not aware of it affecting me? Maybe a little bit, maybe with some fatigue, but no, I don't worry about that. I don't take it on.
Yeah, it sounds very important to like be able to separate yourself from
Yeah,
like being there as a support instead of taking it on your own.
it's a healthy boundary that a practitioner must have with a patient for both of them, for both
Yeah,
parties. Yeah.
yeah, for sure.
It's not for me, right? Like I said, it's not for me to carry. It
Right.
doesn't do anyone any good. So,
Yeah. It's for you to support. I love that. I love that mindset. It's such a good shift.
spiritual work does it. When you believe in God and you work on that faith and trust, like, it's much easier to let go. Trust
Yeah.
that when they walk out the door, it's gonna be okay, as long as I did the best I could.
I feel like there's a huge component of trust when it comes to this type of work.
Mhm.
Um, how does how does it look when or if you're able to help someone learn how to trust their intuition or their emotions or their body again?
Well, it has to be done in a very safe way. So it's not like people come in and, in the first minute we're unraveling and untying knots and they're saying, very deep, important things like it's a process and it's done in steps and stages. And the way I start in my treatments is first getting the body physically calm. I make sure the environment is serene as much as possible. And then I help the body get calm. So one of my favorite things is topical magnesium, something easy everyone could do at home. Apply topical magnesium every day. That's how the body begins to settle and relax. And then truly like working with the person where they're at and only going where what is possible. That is safety, creating safety. And I try to help women become aware of their body's messaging. So when a symptom or a feeling, a fear comes up in session, we look at it. We don't rush anything. We explore it. Um, and I teach them how to do it in a place of trust and safety and strength.
That's
But
so
it's a
important.
journey. Yeah, it's a journey. Takes time, a lot of hard work.
Yeah. What feels the most misunderstood about what you do? And what would you like to clarify for anyone listening?
There's a lot that's misunderstood because it's just not understood,
Yep.
right? I think there's a misunderstanding that it's a real medicine with very sophisticated technique, methods of diagnosis, very specific treatment modality, particular to the person. Another thing people think is that the needles have medicine in them. Like there's nothing that goes in the needle. The needle's just a tool to help the body do what it needs to do. Um, because there people are like amazed at how calm they get, right? I think there's something being injected. What else? I think maybe a misunderstanding that it's not strong medicine, right? It's not going to be as strong as an antibiotic or something. And that's definitely not the case. It's incredibly strong, which is why we're so careful how we do it. And also that our training is a minimum of 4 years where we learn both Western and Eastern medicine. So
That feels important to know that they go hand in hand or that they can go like that Western and Eastern
oh
medicine
yes,
can go hand in hand.
absolutely. Absolutely. They often need each other. Like,
Yeah.
let's say a person, has a really bad case of bronchitis, right? And they're not able to function, breathe, right? They might need very fast intervention in Western medicine, absolutely. But then what happens is that cough or the effects on the lungs will linger for weeks and weeks, really interrupting life, weakening a person. I see this a lot actually. And that's where Chinese medicine comes in. So after that antibiotic is finished or whatever the course of treatment, steroids, they come into Chinese medicine and they get their immune system restored. We have great herbs for the lungs that help the lungs heal even more, stop the coughing. And yeah, it's a beautiful example where they can work together.
Wow. Yeah, that's a really good example. I think that's, for me, one of the biggest takeaways that I want people to know, whoever's listening, that Western and Eastern medicine have a place within each other, and it's so important for them to work together sometimes.
Hmm. Yeah,
Yeah. Is there
definitely.
anything that you want to make sure people hear and take away before we close?
Self love. I find one of the biggest things I'm teaching women in the office is self compassion, being kinder and easier to yourself. It's a journey that I took in slowing down. Like you said in the beginning, the benefits of slowing down doesn't mean you're being less effective. in the world and less productive. But I think we can find a place where we can operate from, instead of speed and stress, we can operate from love, peace,
Yeah.
passion.
Yeah. I love that. That is a very good takeaway. It's such an
Yeah,
important reminder.
it's just like a shift, a little bit of a shift. Like you can do the same thing, like clean your kitchen, and you can do it from a place of constriction and stress, or you just take a moment to offer yourself compassion and love, and walls come down, and it's a different experience for the physical body and the mind.
Yeah. I like that.
Mindfulness.
I like that a lot. As we close, I keep thinking about how many women feel like they're supposed to push through, especially in pregnancy and postpartum. And like slowing down is something that you need to earn or that you can only do when things get too much or fall apart. And I like this conversation because it feels like a reminder that healing and self love and mindfulness don't need to be dramatic and they don't need to be rushed. Sometimes it can be slow, sometimes it can be quiet, sometimes it can just be knowing what options exist and that there are women out there who genuinely want to help and support you no matter what you're going through.
Yeah.
To whoever's listening, you don't have to know everything. You don't have to decide to do anything with this information. You don't have to do more with it. It's here for you to know and be aware of as an option. Miriam, thank you so much for being here, for sharing your experiences, and for the care that you bring into the world. I'm so
Thank,
grateful for this conversation.
thank you, Chaya, so much. Really. It's good to be here.
And to anyone listening, I hope you're ending this episode feeling a little more settled, a little more reassured, and a little more held. And we will see you here next time at Evening Tea. Thank you for spending this time with us. If this conversation stayed with you, consider sharing it with another mom who might need it too. Until next time, trust your intuition, move gently, and take care of yourself. Good night, mamas.